Good afternoon, everyone. Welcome to another Journal Club presented by Florida Medical Directors Association, the Florida Society for Post-Acute and Long-Term Care Medicine. Today's date is November 18th, and we will be talking about preparing for a vaccine. I am going to be joined today by Ginny Hoar, who is our special guest, and we're going to go ahead and start with our agenda. As per the usual, we're going to start with our COVID state of the state, and I think we're all pretty aware of what we're seeing around the country, which is a surge in cases. I believe when we were here last on November 4th, we were around 9.3 million cases, and as you can see, we're 11.3 million now. We're seeing pockets of surges throughout the country in multiple regions, multiple areas, from Texas being the first, I believe the first state to cross 1 million cases, that followed closely behind by California, to news of North Dakota having some of the highest morbidity rates globally. So we definitely know that we are in that, I don't even know if we would call it a wave, but more of a tsunami right now throughout the country. And, when we're looking at the trends, I believe when I shared this graphic the last time, we had 35 states that had higher than recommended positivity rates. Now you can see there are 45 states with higher than recommended positivity rates. Florida positivity rate over the average of the last 7 days was 8.73%. And then when we look at where the United States was for the daily positivity rate, this was updated this morning as of 3 a.m. The United States was at 10.17%, and that is a remarkable escalation from where we were even 2 weeks ago. That really means that the daily cases confirmed were over 150,000. So quite alarming. When we're looking at Florida, the latest updates from that usually happen at 11 a.m. We still haven't gotten those numbers, but as of yesterday, we were over 897,000 cases, with Miami-Dade and Broward leading with new cases. When we look at the daily positivity rates for Florida, on the Florida Department of Health website, they really go through and break down day by day. So you can see that on Monday, our positivity rate on the daily positivity rate was 8.64%. Meaning that on Monday we had 7,300 new cases identified. The good news, and I think the real bright spot, is that when we look at the trend in the nursing facilities, we still see very low positivity rates, both among the staff and the residents. And I think this is a testament to the fact that we are testing quite frequently in those facilities. And I think that is one of the highlights that we've seen, at least within the state of Florida. Unfortunately, that is not the story around the country. And so we are getting some alarming news from different facilities in different areas of the country where they're on like their third outbreak. So it is really alarming times. And even though we were when we were preparing this journal club and looking for guidance on who can help bring us news about being prepared for the vaccine, we were expecting all the news that we've seen in the last, I would say, week, and even in the last day. So it's actually just ironic that we have such good timing. And that leads us to our discussion with Ginny Hoar, who is the clinical manager for long-term care with Omnicare, a CBS Health company. And Ginny, I'm going to let you introduce yourself, and then I'll drive your slides. You just tell me when.
Great. Thank you very much, Dr. Cepeda. I am Ginny Hoar. I've been a consultant pharmacist since, it's been about 17 years now. So I've been in long-term care most of my career, and just last year took the position as clinical manager, one of the clinical managers here in Florida. So I cover basically I-4 South is my territory, and all of the nursing homes and consultant pharmacists in that area. So I'm thankful that I'm getting the opportunity to join you all and look forward to more opportunities, and excited to discuss this topic. It's ever changing. I thought the other night, I should almost put up just a slide of a horse race, because it almost seems like it's just a constant battle of who's going to get their vaccine out fastest and who will get their efficacy rates to be most impressive, and all of that. So as we go through some of the slides here, you'll notice that one of the slides is already outdated as of this morning. And I think that's just where we are in the pandemic and in the vaccine trial right now. So encouraging news coming, and I think it's exciting for all of us. But just to give a general kind of overview of the vaccine trials and updates associated with that, one of the interesting facts that I read the other day was that for patients or people in the general community who have already had COVID, a COVID diagnosis and a COVID positive test, that will not exclude them from getting the vaccine. They would still be considered appropriate for the vaccine. And in our environment of long-term care, they would still be prioritized to be one of the first to receive the vaccine. So that was encouraging. And then I'm sure, as all of you have read in the news, that certain states, even once the vaccine is officially approved and ready for release, different states will be or have said that they will be conducting their own safety reviews of the vaccine before distributing it. Florida is not one of those states to my knowledge, so as soon as it's approved, we should be ready to go here in Florida as far as distribution. And then, as I'm sure you all are aware, healthcare workers, those in critical and essential industries, people with that are at high risk for severe COVID illness, and then those over 65 will be recommended to be those that are early vaccinated and prioritized to receive the vaccine once it's available. So I'll just kind of briefly go through a couple of the vaccines that are the front runners right now. The first, obviously, being the Pfizer vaccine. And this is the slide that's already outdated. They did come out last week, I think it was, with some data from their trials indicating that their vaccine they found to be 90% effective. This morning, they just released additional information stating that when they've gone back and looked at all the data, and I believe they've finished their trial now as of the reports I was reading this morning, they noted that their trials indicated an efficacy rate of up to 95%. And then when they excluded just those people over the age of 65 that were involved in the trial, the efficacy rate was still right around 94%. So that is that's great for any vaccine, really, to be showing that kind of data. And hopefully we'll continue to see those results as the vaccine gets distributed and used in the general population. As far as safety concerns, most of the trials are showing no serious safety issues. Most of the side effects are your general side effects you see with any immunization: sore arm, mild aches and pains, maybe a slight fever, but nothing serious. Pfizer is reporting, and this obviously it's proving to probably be true, will most likely be submitting for their emergency use authorization possibly sometime this week, the third week of November. And then that'll just kind of further get the process of getting it distributed rolling. The Pfizer vaccine is a 2-dose series, and that's 3 weeks apart that the vaccine has to be given. And as far as efficacy goes, in their studies, they showed that the efficacy was reached 7 days after the second dose was given. So within a month of the first dose, most people should show immunity to COVID, which is very encouraging. The big negative with the Pfizer vaccine are the storage requirements. It must be stored, and I see varying negative degrees according to what site you may look at, but the vaccine itself must be kept very, very cold. One source I looked at said negative 94 degrees Fahrenheit. If it's not stored at that temperature and it's stored at room temperature, then it's only good for 5 days. So that does pose some issues as far as distribution and making sure the vaccines don't go bad before they're actually administered to the patient. Next slide. And then the second big front runner is the Moderna vaccine. And they are towards the end of their phase 3 trials also. Their studies included 30,000 participants, and they had a good percentage of what we consider the high-risk population. 7,000 of their participants were over the age of 65. 5,000 of them were under 65, but had chronic diseases that put them at higher risk of complications from the COVID illness. What's today? The 18th, so 2 days ago, Moderna announced that their vaccine was actually 94.5% effective in their trials. So at that point, they were kind of inching Pfizer out a little bit as far as efficacy, and then Pfizer kind of bounced back this morning and said, well, when we looked at our data, our trials were pretty much that same number. But all in all, just so encouraging for the vaccines in general. The benefit of the Moderna vaccine is the storage requirements are a lot less strict. Their vaccine, their reporting is stable in a refrigerator, a standard refrigerator temps for up to 30 days. So as far as just the supply chain and getting that distributed, that's a definite advantage for the Moderna vaccine. That also is a 2-dose vaccine. Another vaccine that's out there in trials, phase 3 trials, is the AstraZeneca vaccine. These trials were halted at one point and have since been resumed. They have 23,000 participants enrolled, and they're planning on reporting from all the information that's out there that their results will be available by the end of this year. And then Johnson & Johnson is also working on a vaccine. They're in phase 3 of their trials. Their trial was also halted at one point due to a reaction that one patient had, but they've since resumed after they found out that they don't feel that the reaction that the patient had was due to the vaccine itself. And this is currently the only vaccine that is just a 1-dose vaccine, which would be great as far as administration and tracking of patients. But at this point, it looks like the Pfizer and Moderna vaccines will probably be the first 2 to be released. Next slide. And then as far as distribution, I'm sure you're all aware that there is Operation Warp Speed, which is a collaboration between the Department of Health and the Department of Defense with the goal of distributing the 300 million doses of vaccine initially to those high-risk patient populations. The Department of Defense is assisting in this endeavor, basically from a logistics standpoint, since they're very well trained in figuring out how to get things where they need to be quickly and also track all of that that's necessary as part of this distribution. And those things that we don't commonly think about too, I think sometimes I just think vaccine, but you have to think about all the other things associated with it: needles, syringes, swabs. All of those things will need to be accounted for, and supplies will need to be obtained. So the government is helping in that aspect of it. As far as the logistical supply chain side of things, how do we keep track of where each vaccine is? How do we make sure the vaccines are properly stored in refrigerated trucks or dry ice trucks if needed? And then how do we get that vaccine to the point of care sites as efficiently as possible? And so McKesson is probably the big player in that part of the distribution, just getting the vaccine to where it needs to be as quickly as possible. And then some other suppliers such as FedEx and UPS are also helping in that process. Next slide, please. A couple weeks ago, again, I'm sure you're all aware that the CDC announced that they were partnering with CVS and Walgreens to offer on-site COVID vaccination services for residents, not only in nursing homes, but also in assisted living facilities. And the purpose of this partnership is just to ensure basically the end-to-end management of the distribution, making sure that all things are accounted for. Like I said before, that we know where all the vaccine doses are, where they need to go. Are the ancillary supplies available? Do we have a way to ensure storage of these vaccines? So this partnership that has been formed is responsible for everything from the cold chain management to giving the actual vaccinations on site, to fulfilling the reporting requirements that will be a part of this, to make sure that we know who got the vaccine, when they got it, when their second dose is due, making sure that safety factors are considered, especially in our patient population, and then reducing that burden on the long-term care facilities. I think we all know our homes are just utterly exhausted from this year. So to throw one more thing on them right now with everything they have going on and say, okay, now we need you to vaccinate all of your residents, all of your employees, it's just going to be nice that that burden will be taken off of them, and that CVS and Walgreens can help fulfill some of that for these different homes. Next slide. And then I just kind of wanted to highlight what the different facility level players, what their level of participation will be, because I think we think globally this is being organized very well and in an organized fashion so that we make sure things get to where they're supposed to be in a timely fashion. But at the facility level, what does the medical director need to be doing? The consultant pharmacist, what does the facility need to be doing? As we know, most of our facilities, mid to late October, were asked to sign up if they wanted to participate in the partnership so that their residents would receive the vaccine. So if they were a SNF, they had to go in through the National Healthcare Safety Network and indicate which provider they would like to use. And same with ALFs, they went through a different site and indicated which partner they would like to use. And I think as the process continues on, the important part of the facility's involvement is just going to be the active communication that they have with whatever pharmacy partner they end up being assigned, so that things are communicated. If the vaccine clinic is going to be there on a certain day, the homes are ready. I know I've gotten a lot of questions around consents. Do we have a consent ready yet? Can we start getting that? So there's just going to be a lot of questions that arise as we get more information with the approval of the vaccine and the distribution of it. And just the homes making sure that they're ready for when those on-site vaccination clinics show up. And then as far as the medical director and consultant pharmacist, we all know that long-term care is just, it's a very unique environment that a lot of people who have not worked in long-term care, they may be healthcare professionals, but I think through all of COVID, we all realized how little our colleagues that are outside of long-term care really know about how things even work in a nursing home or an assisted living facility, and how we can just be an asset as far as explaining to them the patient population, the logistics of just serving these patients. So the more the medical directors can do, or the consultant pharmacists can do, just when questions come up as to best ways to handle things, just really serve as that expert for the long-term care environment. When the vaccine clinics are on site, again, just dealing with the patient populations, giving a a geriatric demented patient a vaccine is much different than giving a vaccine to a person who walks into a clinic to get their vaccine. So just there's probably going to be a level of education required on that side of things. And then I think, there's all kinds of theories and misinformation floating around as far as vaccine efficacy, vaccine safety. So just being able to provide those facts to our facilities as far as how effective the vaccine is, how safe it has been proven in the trials, because we all know the more people that are vaccinated, the lower the cases really should end up being. And that's probably the solution to us getting back to a quote unquote normal, is just finding some way to prevent COVID from spreading. So those are just a few of the topics that I wanted to cover. If y'all have any questions or comments, I'd love to have a conversation about it.
Yeah, Ginny, thank you for that. I think you hit on every one of the major points that I wanted to ask about. I think there's been a lot of questions that we've been filtering around what the on-site clinics will really look like. And I'm just curious, I know that Omnicare is with CVS and that Walgreens also has a long-term care pharmacy, but how are you anticipating working with those other entities who may be in the nursing facilities, such as the other pharmacy consultants that we know we all see throughout the state? I'm just curious how that relationship is going to be between Walgreens, CVS, and the other entity.
Mm-hmm. That's an excellent question. And you're saying, so if there's a facility that's serviced by a pharmacy, a long-term care pharmacy that's not CVS or Walgreens, what does that look like when that clinic shows up, and how does the consultant pharmacist work with that clinic, so to speak? And a lot of this is still, maybe after the 1 o'clock call I have today, I may know more information. I think from my standpoint, we've not even been given a ton of information, because I think we just, we have to even wait for a vaccine to be approved. But I can say that I know with CVS, we have tons of experience with those on-site vaccination clinics, because we've been doing it for flu, pneumovax. So that entity in itself is very familiar with this process. I think the best way for medical directors, consultant pharmacists to work with the on-site clinics, regardless of who your provider is just to be in constant communication with your facilities, know when the vaccination clinics will be on site. We're still not sure on our side what the consultant pharmacist role will be as far as maybe a liaison. And that, we may find that we'll then reach out to maybe the providers for those other pharmacies. I think a lot of that's still to be determined, but I would say the best way just to stay in contact with what's going on is to just be in constant communication with your facilities and find out when they've been notified that a clinic may be there to administer the vaccines. 2 weeks from now, I may even have more information. So would be happy to loop back and share any information that we get on our side over the next 2 weeks.
Yeah, that would be very helpful. I know also that at least in Florida, what the Department of Health has put down in their plan is the time-phase vaccination strategy. And I believe that for long-term care, SNFs and long-term care units, we're in that first phase. Do you have any insight that you could share with us about that?
I wish I did. I don't have any insight so far, other than I do believe, obviously, that long-term care will be the first phase. And like I said, I wish the call I have today would have been before this call, because maybe I would have more information after that. But no, I don't have any specifics, sadly.
Yeah, you also mentioned building vaccine confidence. We've been talking a lot about that. And what do we need to do now? What should we be doing as far as educating our facilities and the facility staff at this moment in time?
I think, and this is what we've told our consultants, the best thing to do is just make sure that you are staying on top of whatever the most recent information that's been released. Know which vaccines are close to the approval process with the FDA, know the side effect profiles of the vaccines, know the efficacy rates, so that you have that information to share with your facilities. Make it a part of your entrance and your exit when you're talking with your facilities. You almost don't have to ask, because I'm sure everybody, it's like all of our consultants, when we're in the buildings, that's one of the first questions they ask us. What do you know about the vaccine? When's it going to be ready? And I think too, if you do have homes that seem to be pushing back and maybe not on board with it, that's a great opportunity to just dispel some of the rumors that might be out there and just stick to facts and go to Pfizer's website, go to Moderna's website, and pull directly from there what their trials are saying. Every day, I know this morning when I was looking at the Pfizer stuff, there's more and more information related to the specifics of the trials. So I think that's information that's really great to share with our nursing homes, because they can then pass that on to residents' families.
Yeah, and I'm curious, and I'm going to open it up for discussion if anyone has any questions or comments, and maybe if anyone knows, like, I don't know how we are dealing with even vaccinating the staff for flu. I'm curious to know what strategies are out there right now that maybe your organization has done to help build confidence around the flu shot, so that because we still see the difficulties there.
Yeah.
So if anyone has any comments, questions, insights, please, we are open for discussion. And you can just take yourself off mute. Everyone is unusually quiet. All right, so I just would want to know, and I do thank you for everything that you're providing to us. I think we have a question in the chat. What is the expected cost of the vaccine?
I had that somewhere, and I don't want to misquote it. I think it was between 20, this is very ballpark estimates, $20 and $40 a vaccine. And I can't remember exactly what the differentiator was. Let me see if I can pull up my information real quick here and get you that.
Any other questions while we're looking for that? Yeah.
No, Dr. Cepeda, this is Dr. Gonzalez. How are you all doing?
Good, good. How are you doing?
Good. Hey, I just want to pick on everybody's brain just to present a scenario. One thing that we see, for example, with the flu vaccine is that, especially on the staff, they start looking for reasons on how to not get the vaccine and get some even medical documentation to validate the right to refuse. And actually, they have the right to refuse it. What would be probably the ideal scenario on how to proceed with facilities that they establish the vaccine with the staff and the patients, but you have staff members that refuse to get the vaccine? what protocols are going to be recommended. And of course, there's not going to be an answer right now, but what protocols or let's say it this way, how are we going to manage those teams that don't get the vaccine because they have the right to refuse it?
If anyone out there is already working on this strategy, I mean, I'm, you know, I don't think I have an easy answer for that one.
No, honestly,
Yeah,
I think
we
there's
all
going to be an
need
answer
to.
for now,
Yeah.
but it's something to start thinking about it, because as medical directors, we're going to be asked, like, doctor, what do you suggest to do? Because we have 5, we have 10, we have one staff member that is refusing to get the vaccine. And I mean, we cannot force them, but we know that staff member can still bring the virus into the building. I mean, it is a catch-22 situation, and that's something that will require a lot of brainstorming. So definitely, I think there's no right answer right now, because there's still a lot of variables in play. But just to pick on everybody's brain to start thinking, and probably at some point we can have a conversation and get a consensus on our side on what would be the best approach for that.
Yeah, and I think I think you might have volunteered yourself for something, because I can really see our COVID Innovation Task Force taking the lead on that and putting together some recommendations. I believe Eric Capone, I don't know if I said your name right, but did share the cost of the vaccine as being $19.50 or $39 for both doses. So. If anyone did see the chat.
Just saw that. I just actually Googled that too to see the cost, because the information I had was the CMS reimbursement information.
Yeah.
And that was $28 for the single shot, which would be Johnson & Johnson's, and around $45 for the 2-dose series. But that's the reimbursement side of things. So, but around the same price too for the vaccine.
Yeah, I know that there was some discussion, at least within on you know, in my organization, about the fact that CMS said they will cover it. It'll be covered under fee for service, and a lot of the Medicare Advantage plans don't yet have a rate for it, so it's being covered under the traditional fee for service.
Mm-hmm.
Any other questions, comments, or insights? And if you're shy, just put it in the chat. Well, Ginny, I think if we don't have any other questions, I think what we can do is definitely bring you back, circle back, so that we can see the progress. I think this is something that we're going to have to really keep our pay close attention to. And I would love if anyone else is interested in, besides Dr. Gonzalez, who volunteered, interested in helping write some recommendations on how we build vaccine confidence. We need to. We're open to your volunteerism.
I would love to, Dr. Cepeda.
Dr. Gonzalez, you had another comment?
No. Just this is going to get a lot of involvement from all the medical community and all the post-acute care world to be able to handle it the best way possible, definitely.
Yes, I agree. Thank you, everyone.
And it is.
Oh, sorry, Ginny.
It's just so surprising. No, I was just going to say it is surprising, I think, for us from who are clinical and rely on data and facts, just the amount of misinformation that's out there. So just echoing that we will have such an important role in making sure the accurate information gets communicated. So, and thank you for allowing me to join you all. And I look forward to following up in a few weeks, and hopefully we'll have a lot more information by then.
Thank you.
Mm-hmm.
Thank you, everyone. We'll see you in about 2 weeks.